What to ask or to know about a pelvic floor therapist before seeing them. Hi, I'm Dr. Kaylee Simmerman, pelvic floor physical therapist, owner, founder of the Hope Doctors Pelvic Floor Physical Therapy in St. Petersburg, Florida. Super excited to talk about this topic because always comes up, always a question, but it's also something that I think just you don't really know, right? Because people will search for a pelvic floor therapy and assume that everyone is the same, but that's just not the truth. So first and foremost, it is important to know whether you are seeking a pelvic floor therapist who is in network versus out of network. Unlike most people, I don't think it's a debate. I think you know what you need kind of thing, right? Like just know that in network, someone who takes insurance, there are restrictions. It is a little harder to find a really good provider who can do a full body assessment, who's able to look from head to toe. It's a little more difficult in that situation to be able to find someone that will get you to your 100% goal. If you're looking for someone who is out of network, those are the people that are going to be really efficient typically. I say typically because there's obviously some bad ones out of network too, but we're the ones that have more time. We have more ability to do a head-to-toe assessment, more options with being able to be like work with different parts of your body. We can work with a lot of different pieces of your like body and the things that are going on instead of just having to focus on one. So for like instance, in network can only treat the pelvic floor issue. Out of network, we can treat ankle, foot, hip, low back, all the things. And I say they can only if they document the right way, if they bill the right way. Unfortunately, there's restrictions on that. And again, sometimes you have to choose who your insurance like recommends, and that's totally fine. That's not something that I think is to be shameful or to feel bad about. That's totally fine. I do recommend finding a really good out-of-network provider. We often have conversations with clients about finding an in-network provider, and sometimes you can find somebody that might be able to help you find the right provider. So that's important to know. Are you looking for in-network, out-of-network? That does include the conversation of what's your budget. Out of network, yes, of course, it may seem like they're incredibly pricey up front, right? And you're gonna have less time with them, meaning like you're not gonna have to see them 3 times a week for 12 weeks. The way that we run our practice, we typically see people once a week max. And usually we start to spread that out pretty quickly. So we will usually get clients to seeing us once a month, and that's kind of the goal. And then we'll see you until symptoms are resolved, and then we build for resiliency, which means we see you a little less frequently, but we're continuing to progress, continuing to work on the things to get you to the 100% goal. Because for us, that's the goal. I went out of network when I started my practice because I really wanted to get you to 100%, not just 80% for insurance to say they're symptom free, they don't need to come back. That's not for me. For me is to say you want to run again after having 2 babies, that's where we're going. And so no matter how long that takes, that's kind of the thing. So in network, out of network, finding your budget, those are the kind of things there. I think the second thing to ask is like, what are you actually going for? If it's just urinary incontinence, call the practice and make sure that they treat urinary incontinence. Unfortunately, a lot of pelvic floor practitioners will say things like, we treat everything. I really think that there should be specialists in certain things. For me, for example, myself, I specialize pelvic organ prolapse, high-level athletics. So I love to work with CrossFit athletes, marathon runners, people that are trying to get back to that high-level activity without pelvic floor symptoms. And then we also have a practitioner who focuses on male pelvic health, urinary incontinence, and pain with intimacy. Those are our top specialties. We are equipped to treat the other things. It doesn't mean that we can't, but if you're calling about something like interstitial cystitis, we don't see that as frequently as we think you would deserve, right? So we would help you find a provider that maybe is a little bit better at treating those types of symptoms. So it's important to call and ask about that. I also recommend that you call and ask, like, what does that evaluation look like? Are they looking at the full body? Are they looking at just the pelvic floor? Can you walk me through, this is what you would say, can you walk me through what that first like session could look like? And if they say things like, oh yeah, we're going to do a pelvic floor assessment, and they focus only on that piece, they're probably going to miss something. So you may want to call around and see if you can find another provider that says something along the lines of postural, functional movement. We're tying the pieces together, connecting the dots. We're able to kind of get you in and out. Ask if they're doing treatment on day one or if it's just the assessment. Really important that you get started on day one, especially if you are being treated by a cash pay provider. You're paying for a service. You should have something to walk away with on day one. I also recommend that you ask them kind of again, like, what is their treatment methodology? So like what that means is, are they using things like biofeedback? Are they only doing dry needling? Are they only saying shockwave therapy, right? Those passive treatments can be helpful, but they're not going to get you where you want to be. Like, are they actually going to be doing exercises? Are they trained in functional movement? So if you're calling and you want to return to running postpartum, if they never say anything about like a running analysis or a running assessment, that's a problem. Also ask, are you going to get me into the movement or the exercise that causes the issue? And if they say no, meaning I don't have the equipment in their clinic, or for example, if you're a CrossFit athlete and they don't have a squat rack bar, right? Like that's important to know. You may not be able to get that progression that you're looking for. That's really important. And so being able to find, like, are they going to look at me when I'm doing the thing that causes the symptom? Super important. And then I always recommend that you ask like how the pelvic exam or how the pelvic floor assessment is performed. Most practitioners are trained to lay you on your back and that's it. Depending on your symptoms, prolapse, for example, I'm moving you to hands and knees. We're doing side lying, we're standing. I have you hold weights. I sometimes have you hold your baby. It's again dependent on what's causing the symptom. If you only get symptoms when you're holding your baby, I'm going to have you hold your baby so I can assess the pelvic floor. Very important that you see a practitioner that can actually do that and understands how to do that. And then also the last thing is like, ask the question, what happens if I don't start to get better? Like what happens if I see you for 6 to 8 sessions and nothing's changing? If they say that's not going to happen, they're super confident that that's never going to happen, I'd probably go to a different provider because honesty is key here. I always tell clients, like if we get to a place where you're 4 to 8 sessions in, it depends on what you're coming in for. If you're in a place where there's like 0% improvement, I'm going to be referring out. I'm going to find resources. I'm going to find providers. We're going to collaborate with different team members. We're going to figure out what's going on. I'm going to send you to get imaging, or I'm going to send you to get different tests and diagnostics. Or maybe there's another provider that's a pelvic health practitioner that I'm going to send you to for a consult, because I'm not ignorant to think that I'm the best at absolutely everything, and that's a problem. And I notice a lot of pelvic floor practices, specifically cash pay, are not referring out when it's necessary, and that's a big problem to me. It's a red flag. Nobody can treat everything. Nobody is the best at everything. Nobody can give you an exercise to fix everything. So ask that question so that you know what to expect moving forward, and how is this practitioner going to support you moving forward. On that note, something that just popped up is, how is the home exercise program presented to me? What do I do, right? Like, how do I get it? Is it video format? Can I communicate with you between appointments? Very important. What if I can't implement my home exercise program the way that you prescribe? Like, what happens with those things? It's really important, again, that like these questions are asked up front. And one thing I will say is it's a red flag if you call a practice and they say you can't talk to somebody about these things, or they can't answer that until you book an appointment. Just find another provider who's going to answer these questions for you, because coming to us with a concern is a green flag to me. It tells me that you are going to be a teammate in your care, and that is really important for me. I want to work with clients that understand that they have a part in it too. And so we are a team, and it's something to collaborate on. I obviously have a million other questions that I could give you, but those are the main ones that are coming up today that I think when you call to make a pelvic floor appointment, ask those things. I think it's really important that you do that. And I hope and I encourage that you give us a call if you are in the St. Pete, Tampa Bay area, or anywhere in Florida for a virtual session, so that we can really help guide you. If you are outside of Florida, we are happy to hop on for a wellness consult, pelvic floor consult. We can do all kinds of things in the coaching realm for that. There's lots of different opportunities there, and we can help you find resources and really help you on the way to your goals. But I hope you have a fantastic day, and drop any questions you have below, and don't forget to subscribe.